Hello everyone. Today we'll be talking about normal sinus rhythm. Normal sinus rhythm is also known as NSR. And first of all, we should be aware about the definition of NSR. So basically, the rhythm which originates from the sinus node is known as normal sinus rhythm. We know that heart has its own conduction system which starts from the SA node. SA node is also known as sinoatrial node or the sinus node. सो जो आपकी रिदम है साइनस नोड से ओरिजिनेट होने वाली उसको हम कहते हैं नॉर्मल साइनस रिदम. इट इज ऑल्सो नोन एज द रिदम ऑफ अ हेल्दी हार्ट. सो बेसिकली द हेल्दी heart produces a normal sinus rhythm. So when we talk about how to identify the normal sinus rhythm on the ECG, it is very important to remember that reading ECG is a step-by-step process. We should not be jumping towards the conclusion or towards the diagnosis by looking at the ECG strip, but we should be reading the ECG using following steps, and those steps can be 8 or 9 depending on different people. So the first step is identification of the heart rhythm, right? Heart rhythm can be regular, it can be irregular, but normal sinus rhythm में क्या होगा? जो rhythm होगा, heart rhythm होगा, वो regular होगा. The second and third steps are to assess the atrial and the ventricular rate. So normally the rate has to be between 60 to 100 beats per minute, but if it is more than or less than that, it is abnormal. The next step is identification of the P wave. We have to assess the P wave for its morphology, for its shape, for its duration. And then only like depending on all those factors, we can say the P waves are normal or they are not normal. Then we have to assess the PR interval, whether the PR interval is normal or it is short or it is prolonged. So we have to assess the PR interval. Then we have to see the QRS complex as a whole. कि आपका जो QRS कॉम्प्लेक्स है वो वाइड है, राइट, वो शॉर्ट है या वो बहुत ही प्रोलॉन्ग है. सो वी हैव टू सी द मॉर्फोलॉजी एंड द कैरेक्टरिस्टिक्स ऑफ द QRS कॉम्प्लेक्स. देन वी हैव टू सी द P to QRS रेशियो. Ideally, it has to be 1:1. एक P के बाद में एक QRS complex होना चाहिए, फिर another P wave होना चाहिए. But in some of the abnormal conditions, it can be like more than that also. 2:1 also, 3:1 also. But in normal sinus rhythm, we should have 1:1 P to QRS ratio. And then we have to see the T waves, okay, the morphology, shape, duration of the T wave. So when we talk about the normal sinus rhythm, all these steps with their normal findings are being given here in the slide. So rhythm क्या होना चाहिए NSR का? It has to be regular. Atrial rate should be 60 to 100 beats per minute. Ventricular rate should be 60 to 100 beats per minute. P waves should be upright. They are the positive deflections in the leads 1 and 2. And in AVR, like in the last video also, I had covered about the Chamberlain's rule of normal ECG, where I had mentioned about this step, this one of the rule that आपका जो P wave होता है वो AVR lead में क्या होता है? It is inverted in that, and duration of P wave is less than 0.12 seconds. So less than 3 small boxes में आपका P wave cover हो जाना चाहिए, and its amplitude should be less than 2.5 millimeter. When we talk about the PR interval, इसका क्या रहेगा duration? 0.12 to 0.20 seconds, or we can say that 3 to 5 small boxes. If it is more than that or less than that, it is abnormal. And the QRS complex, normally a normal QRS complex is narrow. Narrow का मतलब क्या है कि उसका duration कितना रहेगा? 0.06 to 0.10 seconds. आपकी 3 small squares के से कम रहेगा उसका जो duration है. And every P wave should have, afterwards there should be one QRS complex. The P to QRS ratio has to be 1:1, and the T wave, like P waves, they are also upright, they are also positive deflections, and they can be sharp or they can be bluntly round in shape. Duration is 0.10 to 0.25 seconds, and amplitude is less than 5 millimeters. So these things you have to remember if you would like to identify the normal sinus rhythm. So if any of these parameter is not there in the ECG, it might be because of some other conditions, but then in that case, you won't be calling it as a normal sinus rhythm. So, and this is how a normal sinus rhythm looks like on the ECG. We can see that the gap between two RR intervals, R waves are equal. Okay, so it is a regular rhythm. When we talk about the rate, it is also normal between 60 to 100 beats per minute. When we see the morphology of P wave, it should look like this. The PR interval should be this much of duration, 0.12 to 0.20 seconds. The QRS complexes, as we have covered, it has to be narrow. The T waves are upright. So this is how, and the P to QRS ratio is 1:2. This is how you have to read the normal sinus rhythm. So that's it for today. Thank you so much.